We are back now. It's the Now Morning Show, and it's a fabulous Friday. We have our artist in residence. We're kicking off Advent. We are doing so much to bring you information on a very positive note as well, so that you can start your day and then you can face the world with whatever you need to. Right now we're talking about World Research Day, or Research Day rather, and it's today, November 29th. Here to tell us more is Dr. Wayne Frederick, President of Howard University. Good morning.
Hi, good morning.
And Magda Bash, who is the General Manager, Health Policy, Research and Planning at the Northwest Regional Health Authority. Good morning to you as well.
Good morning, Lisa.
So Research Day, I call it Innovation, Wellness and Research as the topic, because I believe we're focusing on innovation. I'll start with you, Magda, with innovation and wellness this year.
Sure. Thank you so much, Lisa, for having us. And this morning, I want to invite the public to join us today at Government Campus Plaza Auditorium starting at 8 for Research Day 2019, which is actually the Northwest Regional Health Authority's 3rd annual Research Day. So we're very pleased to have a model and a platform for sharing best practices, novel findings in human health. And I'm going to let our keynote speaker give us a little sneak peek of what he's going to talk about today. But our theme is innovation in healthcare. Innovation in healthcare.
Dr. Frederick, how are you going to, what are we talking about when we're talking about innovation in healthcare?
Yeah, well, obviously, with the advent of technology, artificial intelligence, big data, I think there are lots of things there that can help us deliver healthcare in a much better way. But I'm going to underpin that with those that we can't lose the human touch.
Right.
Ultimately, why we're doing this is because of the altruism of health professionals. We've got to always make sure that there's some equity and balance. And so I'll try to do that in my talk to kind of, as they say, thread that needle.
Yes, and I like the idea of having an annual research day, because research is so important in terms of, and whether it's business or health in this case, in terms of generating best practices, as you said, and providing, because it filters through the university all the way into the man industry, doesn't it?
No, absolutely. And I think research really is that discovery of new knowledge, but so we should always be asking ourselves questions about what we currently do and begging the question as to whether or not there's a better way to do it. And once we do discover that, we have to be bold enough to make sure that we make those changes. So you're absolutely right. Regardless of what you do, you should be always doing research. And so having an annual event to kind of pause and update everyone on where you are, I think is absolutely essential.
There's always a dance, because you're from academia, there's always a dance between practice and research. And I'm going to go back to you, Magda, in terms of the NWRHA, how much, I know that we have the annual research there, as you mentioned, but how much research really happens within our health sector here in Trinidad?
A lot of research actually happens because, you know, Port of Spain General Hospital is actually a teaching hospital as well. So what the Northwest Regional Health Authority does is, of course, focus on patients and patient-centric care. And to do that, to improve health outcomes of patients and to improve sustainability in healthcare, you have to drive research. And so we want to build research capacity for our institutions, our researchers, whether they're clinicians, whether they're nurses, whether they're actual administrative staff getting MBAs or Masters in Health Administration or Hospital Administration. We really want to support our researchers within the authority so we get that sharing of information leading to better decision making and, of course, evidence-based care.
What about the joining of international and local research so that we can learn from what's happening internationally, Dr. Frederick? How does that dovetail into what you're doing?
Yeah, I think it's important. That's one of the reasons I accept these types of invitations, especially here in Trinidad and Tobago. I mean, I went to high school here. I think it has to go all the way into our secondary school system. So that young people who are coming up recognize that there's an opportunity for a career in research, and they recognize that they can take that into whatever careers that they go into. So I had the opportunity to open up a new physics lab at CIC yesterday.
Oh, you're all Saints boy.
So yeah, absolutely. I felt it was important to do that in order to give back, to renovate their lab so that they work in a space that is thinking about innovation and thinking about how they apply those to help others.
And I think innovation is a mindset as well, thinking innovatively and thinking about research every step of the way as opposed to regurgitation. Because generally, when you are now learning, you're about taking in information and then giving it back to the examiner. But we want to inculcate that thought of challenging the status quo, challenging models, creating new models. And at what stage, because I'm not sure that we do it necessarily at a very young stage, maybe at master's level perhaps, but I'm thinking we need to inject that now at a younger stage.
Yeah, well, I'll tell you, I have a 15-year-old son and a 13-year-old daughter. One is in high school, one is in middle school, and they're doing that currently. They're doing that right now.
Yeah.
I have sickle cell. My son wrote a paper on sickle cell last year, and he wrote about CRISPR therapy as an example. Now there are people in the U.S. who have actually been cured by it. So he is already participating in that process of research. I think it has to happen early. I still practice medicine. I operate, not as frequently as I'd like, but every time I do it, I'm doing something just a little bit different to make sure that the patient is doing better. I'm not doing the same things that I did some 20 years ago as well. So all of that is embedded in what you do in your daily career. And I think you have to do in your daily professional life, regardless of what you're doing.
Absolutely, absolutely. I think we need to build on the culture, and I congratulate the NWRHA for having the annual research day to sort of include and encourage research at all levels. It's so important to have a research-oriented society, not just in health, in business, making business decisions. And it's on, we're a very instinct society, but you want to have it driven by facts and figures and a bit of science as well.
Of course.
All right. So I want to thank you. Now, before we wrap up, how can the public participate, or is this a closed
No, it's
event?
definitely for the public, and I want to invite you as well, Lisa,
Yes.
after your show. You can come down.
Yeah.
Again, I'll tell you the time. It starts at 8, and it's at the Government Campus Plaza
right there.
Auditorium.
Okay.
Yes, and it is free of charge.
Yes.
And we welcome members of the public to join in. We're going to have, of course, Dr. Frederick speaking. We're going to have a great panel discussion on the optimization of the electronic health record, which we have implemented in the Northwest Regional Health Authority. So great information that you're going to get today, a day full of science and, of course, innovation.
All right, wonderful. Well, maybe I might take you up on that because it's all day, 8 to 3. And is there a particular time you can go in and out, or you have to spend the entire day? In my case.
My preference is I spend the entire day, but any time you want to come, you're welcome to come.
Yeah,
We're going to have
I
some
know
great, we
my
have 69 posters, we have 6 oral presentations.
Yes.
It's a lot of hard work that our researchers do. We want to recognize them, and we want to share their findings.
Okay, wonderful. All right, thank you very much, Magda Bash, General Manager, Health Policy, Research and Planning at the Northwest Regional Health Authority, and Dr. Wayne Frederick, son of the soil, President of Howard University, on here, on set with me. And I listen, I have to share a little tidbit with my viewers, right? I said, Dr. Frederick, it's so wonderful to meet you. I follow you, and I'm so happy to meet you finally. He said, Lisa, we met last year on this set. Oh my goodness, I need some ginkgo. Thank you. So, no. Where's Remy? Remy, you're supposed to run and ring the bell.
Let's ring the bell. Let's ring the bell.
You know what that means. So, Dr. Frederick, I think
Your
you
turn.
can't.
Yeah, I can move, but I
so
think
I'll have to
he'll
pick for you.
Your turn.
All right.
So you're going to pick one now.
I think I have Dario,
Dario,
6 years old,
6 years old.
Michael, 7 years old. I
Oh,
picked 2 boys.
wonderful, wonderful. Well, thank you so much for
Sure, my pleasure.
being a good
Absolutely.
sport there. Of course,
Oh,
we're
my
going to get
pleasure.
the
Absolutely.
gifts on you. We'll organize, right? But of course, the gifts are going to go to the children from the schools from Cocorito all the way to Point Cumana, courtesy the Seafront Lions Club.